on here.
Okay. So you want me to introduce myself?
Yeah, so, hi, hello. Could you state your name and your profession and your role at Christiana Care?
Mm-hmm. Sure. I'm Elizabeth Brown, MD, MSHP, and I am the Harrington Clinician Scholar at the Value Institute and also a practicing family physician with the Department of Family and Community Medicine at Christiana.
I see. And have you been at Christiana Care for, how long have you been at Christiana Care?
I am coming up on a year at Christiana Care at the beginning of October.
Okay. And how do you find your experience thus far?
It's been a fantastic place to work. It's really at the forefront of thinking about how do we work as a healthcare system rather than being just a hospital. It is really taking the initiative to think about the population that we serve, and that really is the state of Delaware.
Why was this conference important to you? What do you hope to get out of this conference?
Mm-hmm. So as a family physician, I work in primary care. So we are...
Pause. Repeat kind of the question.
Oh, okay.
Because they can't hear me.
Got it. Okay. So this conference has been really important to me personally because I'm a family physician. I take care of patients who have multiple medical needs, and one of those is chronic kidney disease. I also, have plenty of patients who have the precursor diseases to chronic kidney disease. So I take care of a lot of patients with diabetes and high blood pressure. And I absolutely cannot do any of this alone. I need my colleagues in other specialties, including nephrology, to help support me in taking care of those patients with CKD, as well as those patients who are on their way, and helping to think about how we can make some changes in their care so that we can prevent them from getting to the point of having chronic or end-stage kidney disease. So I'm really looking forward to making connections across the state and between disciplines here.
Excellent. Now, there were several presentations. I think, do you have an interest in healthcare disparities? Is that one of your focus areas?
Mm-hmm.
So you heard Dr. Cruz's presentation. What struck you with that presentation?
Mm-hmm.
What impressed you or impacted you?
Mm-hmm. So I do have an interest in healthcare disparities and making sure that we are getting healthcare to all of those who need it, including those underserved populations. So during Dr. Cruz's presentation, I really appreciated how she got down to the really granular level and said, we can think about patients with chronic kidney disease, but we really need to think about the things that affect outcomes for those patients, including things like poverty and socioeconomic status, as well as gender and race when we think about looking at the patient and how we can best serve individual patients. So we need to think about the chronic kidney disease population, but we also need to be able to cut down to women with chronic kidney disease, African Americans with chronic kidney disease, those living in poverty with chronic kidney disease, because there are multiple factors that affect outcomes.
How important is it to have a registry, and how would that registry be used, or do you think it should be used?
Mm-hmm. So when thinking about the importance of a registry, I can put on two different hats. So first, as a researcher and as someone who's interested in health disparities, we really need to have a repository of data about patients so that we can determine whether any of the care interventions we're making are having a difference for the population as a whole. And then for specific segments of that population, the underserved, those living in poverty, those with Medicaid, African Americans, and other minorities, those kinds of things. Then I can also put on my primary care hat and say, having a registry would be great, a place where I can get all of the data, all of the lab work for my patients who have chronic kidney disease, the notes from the specialists. It's really essential to providing care as well.
Why do you think that's not already happening? What has prevented this from happening? It seems for those of us who may not be providers, wouldn't this already exist?
There are many people who wonder why a great centralized pool of data for things like chronic kidney disease doesn't already exist. There are a variety of reasons for that. One is that it's really important that we think about the privacy issues around this data, and that we are sharing data in a way that's absolutely secure so that we can assure our patients that their health information is remaining protected and private. So those privacy concerns have led to some fragmentation in this system. In addition, healthcare is an industry that has been struggling to catch up with technology as compared to some other sectors. We use it, and we think it's absolutely essential, but across healthcare as a whole, not just in kidney disease, we've had some struggles with sharing data between different entities, and it's really, we're still in a learning process.
Okay. Are you a participant in the workshops?
Yes, I am going to the, I forget the names of the chronic kidney disease workshop.
Okay.
Yeah.
And are you a moderator, or
Mm-mm.
okay, what do you hope to get out of that workshop? Or what are
Yep.
your interests in attending?
Yeah, so I'm really looking forward to the workshops this afternoon. I think it's going to be a great opportunity to share information from different perspectives. So I'm really looking forward to hearing what some of our patient participants have to say today, some of what their concerns are. I'm really looking forward to hearing from the nephrology and specialty side what some of their interests and concerns are, and some of the opportunities that they see for sharing information across the system. So I'm really, the panelists have been fantastic, and the large group talks have been really informative. And now I'm looking forward to taking some of that information to a smaller group so that we can really get more voices heard.
And you mentioned that you're an investigator.
Mm-hmm.
What are you investigating? What are your current projects or areas of interest?
Yeah. As a clinician scholar at the Value Institute, I have a research role as well as a clinical role. One of the things that I'm working on right now is looking at how we can use teams in primary care and how we can share tasks amongst the primary care team. One of those things is going to be making sure that we are using disease registries that are available to us to look at how well we're managing our chronic disease population. So this chronic kidney disease registry may fit right into that work. I'm also interested in exploring what are the demographics of our patient population at Christiana Care is overall. So one of the things that I'm working on is looking at the racial and ethnic breakdown of the patients who are accessing Christiana Care services and comparing that to the population, the general demographics of the population of Delaware.
I want to ask her a question about an unrelated topic while we have the film.
That's fine.
Okay. So you recently had a publication in Health Affairs.
Mm-hmm.
What was that about?
Mm-hmm.
Why was that? Why was that important work?
Mm-hmm. So I, as well as a team of colleagues at the University of Pennsylvania, recently published on the distribution of primary care providers across the city of Philadelphia. So primary care is the entree to all of the rest of healthcare. It's where people access prevention, chronic disease management, as well as access acute care for medical conditions. So it's really important that everyone have access to a primary care provider, and that primary care provider be available to them in close proximity. So what we looked at was the spatial disparities in access to primary care at the neighborhood level in the city of Philadelphia. Previous work has been done looking at access to primary care, but it's really been at much larger geographic levels, so the state level or the county level. And we really wanted to drill down and see, between neighborhoods in Philadelphia, is there equality in access to primary care providers? And what we found is that there are huge differences across the city, and that the areas of the city that tend to have less access to primary care providers tend to be overwhelmingly minority neighborhoods. So neighborhoods with high percentages of African Americans, and to a somewhat lesser extent, Hispanic populations as well. We think that's really important because it points out that in an urban area, we need to be thinking smaller than the city level. We need to really get down to the neighborhood to think about what factors may be affecting people's health.
And it sounds like that ties into the kidney issue that Dr. Cruz talked about, where having access to a nephrologist apparently had an impact on outcome.
Yeah, so primary care is just one aspect of the healthcare system. So we need to make sure that, at a very small geographic level, people have access to, first of all, an environment that's going to allow them to be healthy. So things like healthy food and exercise opportunities and safe places to live. But then also that we're making sure that people have access to primary care, which is one part of the healthcare system, but then the ability to get connected to specialists and hospital care if people need it. So it's we really need to think about the micro level, the environment that people are living in, the slightly larger level to look at access to primary care, and then if we need more specialized services, making sure that people don't have to travel really far distances to be able to get those services.
So as far as today goes, and it sounds like one of your goals is to see the outcome of having a register that's consistent, that's real. Is that? Could you speak about that a little bit?
So, one of the goals for today is really to find out what different stakeholders want out of this chronic kidney disease registry. From my primary care provider perspective, it is being able to share data about patients with my specialty colleagues and to find out information in a real-time fashion so that we can understand what we need to be doing to better care for these patients. There are a lot of different potential outcomes for a kidney disease registry such as this. That's really just one of them. I also think it's really important that we make sure that the patient voices are heard so that we are asking research questions of this data that's important to patients, because ultimately that's what we're all here for. Research is really most effective when it's being driven by questions that are going to ultimately matter to patients in the long run.
How excited are you to be here and to be involved in all this?
Oh, I think this is a fabulous opportunity. I'm really excited to have this opportunity at Christiana Care, where we have a diverse group of people coming together to talk about these issues. It's really, I have to applaud Dr. Jurkovic for her tenacity in pursuing the funding to make sure that this could happen today. And I really appreciate that Christiana Care and the Value Institute have put effort and resources behind this. I think it's a great opportunity for us to share.
Wow, great. Is there anything else we haven't answered? I'm sorry, Judith.
No.
Is there anything else that we haven't answered that you might want to tell people?
Let's see. I really think that Delaware is in a really unique place to think about population health because we're a relatively small state. We are all working to take care of a relatively contained population, and the more that we can think about how we can affect that population as a whole, we are going to be really at the forefront of healthcare across the country.
Well done.
Okay, thanks.
Thank you.
Well done.